We have, what we call super producers. Those are individuals, clinical providers that are producing 2-3x, what a typical provider does. Or, they, for example, in dentistry, maybe they're a general dentist, but they focus all of their work on implants. And so, that's its own skill set. And so these are things that become important because you have to consider, who is on the buy side and how are they going to be looking at the business. So if you're someone that, again, produces on your own with your two hands, say $2 million of revenue, there's not many people that can execute at that level that can take over the practice. And so therefore, there's more risk associated with that. And there's risk that, or almost a likelihood that the revenue is going to decrease. And because of that, that's going to impact your valuation. In the case, very similarly with somebody that maybe has a limited scope of service or has a specialty. Again, it's looking at the buyer pool and understanding how easy will it be for, the successor to replicate and replace that revenue stream. And so there is, I think some misconception out there that, someone that is that, super producer is inherently going to have a more valuable business to sell.